Now to share with us some great insight on the ovarian cancer research that is being presented at the 2018 ASCO Annual Meeting, we welcome Dr. Robert Coleman, the Executive Director of Cancer Network Research in the Department of Gynecologic, Oncology, and Reproductive Medicine at the University of Texas MD Anderson Cancer Center. Welcome, Dr. Coleman.
Thank you.
Thank you
Thanks
so
for
much
having
for
me.
being here. Yeah.
Thank you.
So obviously, at some point this year, we're expecting potential FDA approval of Bevisimetinib in the frontline setting. Can you discuss the impact that potential approval might have in the landscape?
Yeah, I think most of the audience would understand that bevacizumab's had a role in ovarian cancer in the recurrent space. There was an expansion of the label from platinum resistant to platinum sensitive. So I think that there was a surprise that actually it hadn't been approved earlier than this. But as to be true to form, and to be aligned with the label in Europe. And in many other countries, the data we think will be consistent, and because the trials it's the same data that's being filed now with the FDA. So we should know in the next 3 weeks that approval. In terms of how it'll impact care, I think that most people there are many people in the United States that are actually using that as part of their frontline strategy already because it can be covered. I think now it'll release some of the other states like Texas, where I am, where bevacizumab is not approved for frontline. So once that's done, I think it'll become very pervasive as an option, soon to be then looked into in the context of some of the other ongoing trials that we hope to see soon too as well.
Definitely. Now, there's a combination study of bevacizumab being presented this year with bevacizumab and mirvetuximab soravtansine.
Yeah.
Can you share some insight on that abstract?
Yeah, so mirvetuximab we've known about for some time. There's a phase 3 trial that's now completed accrual, and obviously we're very interested in seeing how that plays out. But it's kind of a newer class of drug that's that we call an antibody drug conjugate that targets folate receptor alpha, and we know that among solid tumors, folate receptor alpha is expressed in a lot of ovarian cancer. So there's been attention paid to it with a number of other assets. This one seems to have legs. It's been presented here a couple times in their phase 2, and now the phase 3 seems to support it. So it would be natural that they would look at the taking this efficacy that they're seeing with the single agent, and then looking at reliable partners. So this trial, Forward 2, has actually a number of different combinations. Bevacizumab is one of them. So if we think that this acts like a targeted chemotherapy option, it's not a big stretch to see why Bev wouldn't necessarily be studied, because, as you know, as I mentioned earlier, the indication for bevacizumab in recurrent platinum resistant is in combination with chemo. So this would be a very exciting kind of extension. And so we saw some of the the data at the AACR meeting that looked like there was some promising preliminary data. So we're excited to see it. Yeah.
Now, you are the lead author on the randomized phase 3 Energy Oncology GOG study of secondary surgical cytoreduction followed by platinum-based combination chemo with or without bevacizumab in platinum-sensitive recurrent disease. So can you discuss the rationale for this trial and what's being highlighted? Yeah.
Big title, right? So I mentioned also before that bevacizumab had gained an expanded label in platinum-sensitive. So 213, GOG 213, is a phase 3 trial that had two primary objectives, one of which was to look at the efficacy of bevacizumab in combination with paclitaxel carboplatin in platinum-sensitive patients with the primary endpoint of overall survival. So we met that endpoint, and that was filed, and that's what led to that expansion. So this trial has a second primary objective, which is addressing an endpoint, overall survival with surgery. So if you can imagine, primary ovarian cancer is considered a chemosensitive disease. That's why people get surgery and chemo. So in the platinum-sensitive recurrent space, we thought that the idea of surgery plus chemo would make sense to study, but it's never been addressed in a prospective phase 3 way. So 213 was put together many years ago. I can actually tell you that this trial's objective has been 10 years in the making. So we're very pleased to be able to present the overall survival data. Now, what is interesting about this trial, and I think what will be surprising to a lot of people, is that because surgery has such a prominent role in frontline disease, I think there's a lot of bias that surgery has a prominent role to play in the recurrent space. But in this trial, we did not confirm that. So this is a trial that was set up as a superiority trial that did not meet its primary endpoint. And I've looked at the data in a number of different ways in sensitivity analysis to look around this endpoint, including what we call oligometastatic disease. And this is the disease where there's 1 or 2 or less than 3 sites, and those were all looked at as well as the completion rate, or the R0 resection rate of patients who are undergoing surgery. And what we find is that chemotherapy is the same, has the same outcome whether the surgery was performed or not. So it's a surprising finding. Fortunately, there's 2 other trials that are ongoing. Desktop 3, which was presented here last year, which provided the PFS data that they had a secondary endpoint. So it'll be interesting. I'm waiting to hear the discussion. It should be pretty controversial, but interesting.
Definitely. Now, you made some really great points today, and judging by the variety of abstracts being presented this year in ovarian cancer, what do you think it really says about the ovarian cancer field, where it's going? What kind of data do you think we could see at next year's meeting?
Yeah, so one of the things I think that people don't realize for this disease, which we call a rare tumor, right? There's 23,000 new cases a year, 14,000 deaths. Those 2 numbers have been stable for more than a decade. Actually, even slightly decreased. But what has changed dramatically is what we call the prevalence of disease. So how many women in the United States have ovarian cancer? That number has increased by about 50% in the last, say, 7 years. So what that tells you is that there are a lot of patients with disease, living with disease. And because of that, they're available to participate in these trials that are evaluating a number of new assets. And I expect that next year we'll see the results of some of the phase 3 trials that are looking at, for instance, PARP inhibitors in earlier lines of therapy, the combinations of chemotherapy with immunotherapy, combinations of anti-angiogenesis with either PARP or immunotherapy. And I think that, we're focused a lot on ovarian cancer, but I think there's going to be some headway made in endometrial cancer as well, and possibly even looking at some interesting new data coming out on cervix cancer with vaccine treatments. So it's a very exciting time for us with having these new assets. And I would say, if you think about the 3 most prominent ones being studied in ovarian cancer, which would be as biologicals, immunotherapy, anti-angiogenesis, PARP inhibitors, each of those as single agents, each of those as doublets, and as triplets are all being studied now in ovarian cancer, and we'll start to see the emergence of that data in the next year.
Nice. There seems to be some really, really great, interesting work ahead.
Yeah,
Exciting.
I'm looking forward to it. Yeah.
Good. Well, thank you so much for joining us today. Really appreciate it, and hope you have a great rest of your time at the ASCO Annual Meeting.
Well, thank you. And I
Great.
appreciate the attention paid to gynecologic cancer. We love it.
Great. Thank you.